Next, I'm going to conduct an eye assessment. I'm going to make sure I gather all of my equipment. I will need a SNELLEN chart, ROSENBAUM, ISHIHARA, and a pen light. First, I'm going to conduct a SNELLEN assessment on my patient, and I'm going to make sure my patient is standing approximately 20 feet away from the SNELLEN chart. And I'm going to go ahead and have you read the lowest line with both eyes.
L, T, F, P, H.
And if you can cover one of your eyes. And go ahead and read the lowest line you can read.
L, T, F, P, H.
And go ahead and cover your other eye. And read the lowest line you're able to read.
L, T, F, P, H.
And so the patient has 20/20 vision, OD, OS, OU. Next, I'm going to conduct, if the patient did have any reading glasses or any other glasses, I would want to assess that as well. However, in this case, the patient does not wear any glasses. So next, I'm going to have my patient utilize the ROSENBAUM. I am going to keep the ROSENBAUM chart approximately an arm's length from the patient, and if you can go ahead with both eyes and read the lowest line possible.
L, T, F, P, H.
If you can go ahead and cover one eye and read the lowest line backwards.
H, P, F, T, L.
And go ahead and cover the other eye and read the lowest line possible.
L, T, F, P, H.
So my patient has 20/20 vision, OD, OS, OU, utilizing the ROSENBAUM assessment tool. Lastly, I'm going to utilize an ISHIHARA for color vision. I'm going to place this in front of you, and you can go ahead and let me know the letter that you see and what color it is.
O, and green.
And can you tell me this shape and what color of the shape is?
Square and orange.
And if we can go ahead and you can trace with your finger from X to X. And what color is that?
Brown.
We'll do one more. You can trace with your finger from X to X. And what color is that?
Green.
Green. My patient has appropriate color vision. Next, I am going to assess confrontation. I'm going to sit facing the client at eye level approximately 2 feet away. I'll have the client cover their eye not being tested, and I will bring my fingers slowly into the peripheral vision from several different directions. You can also utilize another approach from behind the patient and assessing the patient's peripheral vision. I'm going to utilize the second approach. So I'm going to use both of my hands at the same time, and I would like you to directly look straight ahead and let me know when you can see my fingers.
I can see them.
So I want to be sure that it is at a 180-degree angle, that the patient is able to see my fingers enter their visual field. Next, I am looking at the position of their eyes and corneal light reflex. So I'm inspecting the patient's eyes, being sure that they are approximately 1/3 of the way down their face. I am also making sure that they are approximately 1 eye width away apart from each other. The eyelids should cover the top of the iris when the patient is looking at me, in which I'm able to assess here. I'm going to make sure I sit at eye level and shine a pen light from approximately 12 inches onto the bridge of the nose while the client stares straight ahead. The light should appear equally at the same spot on both pupils. So if you can go ahead and stare directly in front of you, I'm going to shine my pen light onto the bridge of my nose, noting that the light is evenly dispersed in each pupil, in the middle of each pupil. I'm going to assess my patient's eyelashes, making sure that they are evenly distributed across both eyelids in which they are. I'm also going to have my patient close their eyes for me, and I am going to palpate gently with 2 of my fingers across the eyelids, the lacrimal apparatus, and the eyeball, making sure that there is no tenderness, swelling, and the eyeball is firm. I'm also going to inspect at this time for discoloration, exudate, or inflammation. So if you can go ahead and close your eyes. At this point, you can wear gloves if necessary. And I am noting that the eyeball is nice and firm. Do you have any pain or tenderness when I palpate?
Nope.
Next, I'm going to assess conjunctiva and sclera. I'm inspecting for clarity and moisture. I'm going to have my patient look up, and I'm going to pull both of the lower eyelids down. So if you can lower your head for me. And if you just want to look up with your eyes. And I'm noting that it is pink and intact. There are no lesions, abnormalities, scars. In some cases, you may note that their conjunctiva may be lighter in color in some iron deficiency anemia. So you may want to note that and assess lab values. I'm also going to have the patient look down. And I'm again noting that their conjunctiva is clear and there is no abscess. I'm also noting at this time that the patient's sclera is white in color. There are no pigmentation or broken blood vessels noted at this time. No discharge upon assessment of the conjunctiva. Next, I'm going to assess the 6 cardinal positions of gaze, testing cranial nerves 3, 4, and 6. I am looking for nystagmus or any drifting of the eyes. I'm going to stand approximately 12 inches away from my patient, and I'm going to hold this pen light right in front of you, and I want you to keep your head nice and straight, and I just want you to follow the pen light with your eyes. And no drifting or nystagmus was noted upon assessment. I'm going to assess my patient's cornea and lens by shining a light directly across the cornea and inspecting the cornea for smoothness and clarity. I am noting that it is convex and clear. And again, I'm going to assess both eyes to assess for symmetry. Again, it is clear and convex. Lastly, I am going to assess my patient's iris and pupils. Both pupils should be equal and round in size. They should also be reactive to light. I will have my client gaze into the distance and bring a light in from the side to shine onto the pupil to identify for pupillary constriction. So if you can go ahead and stare directly into the to that wall. I am noting that there is pupil constriction upon assessment. I am making sure that his iris, I'm looking at his eyes in general. They are blue in color. And again, the pupils are equal and they are both round. They reacted to light upon assessment. And lastly, I'm going to assess, and they accommodate appropriately during during this next assessment of accommodation. I'm going to hold this pen light approximately 3 inches from your nose, and I want you to stare at something into the distance, so stare at the wall, and then I want you to refocus your attention onto my pen light. And again, I am assessing for pupillary constriction and dilation upon assessment. So the pupils did constrict and converge at that time, noting that PERRLA pupils are equal, round, reactive to light, and they accommodate. And that is the end of my eye assessment.